Hello everyone, welcome again to my class in Pharmacology. At this moment, I will be going to discuss to you the concepts of inflammatory response and the cardinal signs of inflammation, which are all important in understanding the mechanism of actions of your anti-inflammatory agents or anti-inflammatory drugs. Now moving forward about your inflammatory response, it is said to be that it is a local reaction of your body towards the invasion or an injury to the cells or the tissues. That is why any injury or damage to the cells or the tissue will lead to a series of events or chemical reactions. In the concept about your inflammatory response, it starts about your tissue injury. Again, it is your tissue injury. Tissue injury. Tissue injury or damage. Okay. Bear in mind that tissue injury or damage can be caused by several factors. It might be toxins or an noxious stimuli, or it can be a offending agent, can be a foreign bodies, can be a pathogens. Example, if your pathogens are those bacteria, fungi, viruses, protozoa that can also lead to infections. Now, what will happen if there is tissue injury or a tissue damage? There are at least three things that might happen that will also initiate the series of events or chemical reactions, leading to augmentation of your inflammatory response. First thing is the activation of your Hageman factor. Okay, what is this Hageman factor? Again, there is Hageman factor activation. Hageman factor. Factor, or also called as your factor 12. Okay. Factor 12. Activation. When the Hageman factor is activated, another proteolytic enzyme can also be activated. That is what we call your kallikrein. Okay, bear in mind that your Hageman factor is a type of a plasma protein. Your kallikrein is also a proteolytic enzyme. Okay, proteolytic enzyme. What will happen if there is formation of your kallikrein? Okay, your kallikrein is responsible for the conversion of a certain type of glycoprotein that is secreted by your liver. This is known as your kininogen. Kininogen. This glycoprotein that is normally secreted by your liver will be converted into bradykinin. Okay, again, your bradykinin. Now, bear in mind that bradykinin can also be converted to another type of chemical. We term this another type of chemical as your arachidonic acid. Okay, arachidonic acid. Now, because of occurrence of your tissue injury, and in response to that kind of injury or damage to that certain tissue in our body, there is also another chemical that can be activated. It is what we call your COX or your cyclooxygenase enzyme. It is a certain enzyme that can be located in our cells of our body. Again, the cyclooxygenase enzyme. oxygenase. It is an enzyme, or your COX, abbreviated as COX. There is what we call COX-1 and COX-2, two types of your cyclooxygenase enzyme. Once activated, okay, activation, cyclooxygenase enzyme. Your cyclooxygenase enzyme is also responsible for the conversion of bradykinin into your arachidonic acid. Okay, there are two things that converts your bradykinin here. It is the presence of your kallikrein, because kallikrein is the one who converts the kininogen into bradykinin. The other one is your COX. Now, what will happen if there is arachidonic acid? Your arachidonic acid is also the one that activates or releases your leukotriene and prostaglandin. Okay, again, your leukotriene. What is this leukotriene? Okay, leukotriene. And on the other hand, if there is arachidonic acid, there is also production of your prostaglandin. Okay. Your bradykinin also has a direct effect to our nerve endings. Once your bradykinin affects the nerve endings or stimulate nerve endings, it causes what we call pain. Okay. Pain. Remember that prostaglandin also causes pain. Your pain, as one of the cardinal signs of your inflammation, is also known as your dolor. Okay, your dolor. The third one that may happen, that will also initiate a series of events during your inflammatory response or inflammatory process, is that there is a release of histamine. Okay, histamine release. Okay, bear in mind that your histamine is released by your, guess what? That is your basophils. It is one of the types of your leukocytes or the white blood cells. Basophils are also released by your mast cells. Okay, what will happen if there is release of your histamine from your basophils or your mast cells? Okay, first, there is what we call your increase in capillary permeability. Okay, capillary permeability. Because of this increasing capillary permeability, some of the fluids into the blood vessels, like your capillaries, take for example this drawing. Let's say this is your capillary as one of the blood vessels. Inside of that blood vessels, there are a lot of proteins there. Okay? And the fluid portion of this, in that portion, is what we call your plasma. So those proteins that are suspended in that fluid is what we call your plasma proteins. Because of increasing capillary permeability, take note, some of the proteins will migrate from in this part, the inner part, into the outside part or into the surrounding tissues. Okay? That phenomenon is what we call exudation. Okay, because of increased capillary permeability, there is what we call exudation of plasma fluid, or plasma protein, I mean. Exudation of plasma proteins. There might be also fluids that will goes out from the intravascular or within the portion of your blood vessels into the surrounding tissue. Okay, plasma proteins. And because of this exudation, this causes what we call your edema. I think you're familiar with the edema. And edema will lead into swelling. In a cardinal sign of inflammation, swelling is what we call tumor. Okay, another thing that will happen if there is release of your histamine is your vasodilation. I think you're familiar with the term vasodilation. And because of this vasodilation, there is what we call redness. Another term for your redness is your erythema. Okay? Erythema. Now, this erythema is also known as your redness, is what we call your rubor. Rubor is another cardinal sign of your inflammation. If there is swelling for tumor, for redness, that is what we call rubor. Okay. Another thing, because of your vasodilation, the blood flow will increase in the affected area or the site of injury. That increasing blood flow is also known as your hyperemia. Increased blood flow. Okay. Also called as your hyperemia. Remia, which means blood. Hyper, there is increasing blood flow in that particular area, the site of injury. Okay, or hyperemia. That phenomenon, hyperemia, will in turn lead into what we call heat. Okay, heat. Now another term for this, as one of your cardinal signs of the inflammation, is what we call your calor. Okay, calor. There is rubor for redness, there is calor for heat. Okay, back again in the leukotrienes. What is this leukotrienes? Okay, these leukotrienes will promote chemotaxis. Okay, what is another term? It promotes chemotaxis. Chemotaxis. The term chemotaxis is the ability to attract neutrophils. Neutrophils is one of also of type of your white blood cells or your leukocytes. It can also attract macrophages. Okay, it promotes chemotaxis, especially for neutrophils. Or macrophages. Because of the chemotaxis, since this type of white blood cells, the neutrophils and macrophages, are being stimulated, you know that the fact about the characteristics of your neutrophils or macrophages is that they have the ability to engulf or to digest the foreign bodies like your bacteria or any microorganisms. That process is what we call your phagocytosis. So it will also enhance the phagocytosis. Again, phagocytosis. And because of that process wherein your white blood cells are eating the foreign bodies or engulfing them, and they also digest some necrotic cells or dead cells. And because of that phenomenon, in that event, there are a lot of substances or molecules from the dead cells of our body and also from the microorganisms or other pathogens. That substances that are being released is what we call your pyrogens. So there is also, because of this phagocytosis, there is release of your pyrogens. Release of pyrogens. Pyrogens are substances or molecules that can also cause fever. Okay, they are fever stimulating or fever producing substances. Inside in our body, there are a lot of pyrogens that are present indigenously. It means to say there are indigenous or natural pyrogens. Example of pyrogens that can be located in our body is your TNF or your tumor necrosis factor alpha, and we have also your interleukin 1. I think you know that there are lots of interleukin, but interleukin 1 is involved also in the occurrence of your fever. Okay, these pyrogens will travel into the hypothalamus. You know that hypothalamus. Okay, hypothalamus. Hypothalamus is the thermostat of our body. It is a thermoregulating center that regulates the normal body temperature. Once the pyrogens travels into the hypothalamus, it will reset our thermostat. That causes what we call fever. And fever in turns has also a relationship in the occurrence of your heat or your calor. And for the certain information, your pyrogens, since I mentioned that it is also released by the microorganisms, one of the common microorganisms that releases a certain type of pyrogens is your gram-negative bacteria, such as your E. coli. And because of the occurrence of pain, or what we call your dolor, especially if the patient is suffering from severe pain brought about by the series of chemical events that is happening inside her body because of a severe tissue injury or damage, this dolor will in turn leads to what we call loss of function. Loss of function, especially those areas or organs of the body that are affected. The loss of function is also one of the cardinal sign of your inflammation. This is what we call your functiolesa. Functiolesa. It is a Latin word for the loss of function. Now let me draw again your attention about your bradykinin. Here is your bradykinin. And take note that your bradykinin is also the one that causes vasodilation aside from your histamine. Since there is vasodilation, then the process will also continue to have redness or erythema, which is your rubor. And if there is vasodilation, again, there is also hyperemia or increasing blood flow that will in turn lead to heat. And the Latin word for that is your calor. Now I have also to emphasize about your two types of your cyclooxygenase enzymes, since I mentioned earlier that cyclooxygenase enzyme can also be activated and that will also initiate a series of chemical reactions about your inflammatory response. So what is these two types of your cyclooxygenase enzyme? We have your COX-1. Your COX-1 can be found in your blood platelets. Okay, found in platelets. Can also be found in your gastrointestinal tract and in your kidneys. Just bear in mind also that your COX-1 produces prostaglandins. Okay, produces prostaglandins. Prostaglandins that protects our stomach, that protects the stomach and also the intestinal lining. And intestinal lining is also prostaglandins promotes blood clotting. Okay, they promote blood clotting. Now, on the other hand, we have your COX-2, cyclooxygenase type 2 enzyme. Actually, they are active in response to injury. Okay, active in response to tissue injury. Take note of that. Then, your cyclooxygenase type 2 enzyme are actually expressed by your macrophages. Okay, expressed by macrophages. Macrophages. And they are induced by your tumor necrosis factor alpha. Okay, induced or stimulated. Induced by TNF. That is your tumor necrosis factor alpha. I mentioned earlier that your TNF, especially your interleukin type 1, are one of the examples of your pyrogens that on the latter part of the inflammatory process they causes fever because they alter or they change the thermostat of our body, that is your hypothalamus. Now, why I am discussing this COX-1 and COX-2, it is because if there is a certain drug that will inhibit the activity of this enzyme, example your COX-1, then chances are there will be no production of prostaglandin that normally protects the stomach and the intestinal lining. That is why patients who are taking COX-1 inhibitors are at risk to have GI toxicity and especially GI bleeding. Okay, GI bleeding. Now, in summary of the process of your inflammatory response, we can now also identify the five cardinal signs of your inflammation. We have your we have your dolor for pain, tumor which means swelling. Then we have rubor, that is for erythema or redness, and we have calor or heat, and what else? We have also the functionlessa or the loss of function. And in terms of how the inflammatory process is being initiated, there you can read the Hageman factor activation, and we have your COX-2 activation or your cyclooxygenase enzyme, and we have your histamine release, which is released by your basophils and your mast cells. Okay, these are the important points that we should have to understand in relation to your anti-inflammatory agents or your anti-inflammatory drugs.